Hi everyone, myself R.Jayapriya from first MSc Applied Microbiology from Sacred Heart College, Tirupattur. We are going to see about coagulase positive Staphylococcus. It is a normal human flora. First, we are going to see about general characters of Staph aureus. It is the gram-positive bacteria. Shape will be a spherical cocci in arrangement. Arrangement will be a bunch or grape-like clusters. It is a non-motile. Capsule endospores are absent. Respiration through aerobic or facultative anaerobe. Optimum temperature will be 37 degrees Celsius. Optimum pH will be a 7.2 to 7.5. It is a normal human flora on skin and mucosal surfaces. This organism are ubiquitous, so there are no geographical or seasonal limitations. It is discovered by Anton J. Rosenberg. He is a German surgeon in 1884. Next, we will go to pathogenicity of Staph aureus. It is transmitted through the direct contact with an infected person by using a contaminated object by inhaling infected droplets dispersed by sneezing or coughing. Incubation period is 1 to 6 hours. And next we will move to virulence factors of Staphylococcus aureus. There are structural components, toxins and enzymes. Structural components have a capsule, slime layer, peptidoglycan, teichoic acid, protein A. And toxins have a cytotoxin, exfoliative toxin, enterotoxin, toxic shock syndrome toxin 1. Next, enzymes. Coagulase, hyaluronic acid, fibrinolysin, lipases, nucleases, beta-lactamase, staphylokinase. Pathogenesis of Staphylococcus aureus. Staphylococcus aureus enters into the surface of skin, grows into a hair follicle and invades sebaceous glands. After that, it triggers fever and inflammation, which are natural responses against infection, and causes the follicle to enlarge and filled with pus compounds of leukocytes, dead cells and bacteria. The infection may spread into hypodermis to form a furuncle or into a neighboring hair follicles to form a carbuncle. And next, Staphylococcus aureus also spread into the blood. A condition is called bacteremia and is carried to the lining of the heart, lungs and bones, it causing endocarditis, pneumonia and osteomyelitis respectively. Clinical diseases caused by Staphylococcus aureus. Toxin mediated diseases. First one, Staphylococcus scald skin syndrome. It is also known as Ritter-Owen retention disease, Ritter disease and staphylococcal epidermal necrolysis, and superficial blistering skin disorders caused by the exfoliative toxins of some strains of Staphylococcus aureus. Exfoliative toxin that cause the outer layers of skin to blisters within the upper layers of the skin and peel. Staphylococcal food poisoning. Staphylococcal food poisoning results after the consumption of food contaminated with heat-stable enterotoxin. Symptoms are nausea, vomiting, abdominal cramps and diarrhea. In more severe cases, dehydration, headache, muscles, crampings and changes in blood pressure and pulse rate may occur. The condition is typically over in 2 days, but it is not unusual for complete recovery to take 3 days and sometimes longer in severe cases. And next disease caused by Staphylococcus aureus is toxic shock syndrome. It is a rare serious medical condition caused by a bacterial infection. The bacterium Staph aureus get into the bloodstream and produce toxins. Symptoms of toxic shock syndrome: a sudden high fever, low blood pressure, vomiting, diarrhea, rash resembling a sunburn, confusion, muscle aches, redness of eyes, mouth and throat, seizures, headache, shock, renal failure and sometimes death. And second infection is suppurative infections. First one, impetigo. The most common cause of impetigo is the bacterial called Staphylococcus aureus. Another bacteria source is a group A Streptococcus. Impetigo is a common and highly contagious skin infection that mainly affects infants and children. Impetigo usually appears as a red source on the face, especially around a child's nose and mouth and on hands and feet. Folliculates. Impetigo involving hair follicles. Furuncles or boils. It is a large, painful, first-filled cutaneous nodules. Carbuncles. Coagulations of furuncles with the extension into the subcutaneous tissues and evidence of systemic diseases. Bacteremia. Spread of bacteremia into the blood from a focus of infection. Endocarditis characterized by damage to the endothelial lining of the heart. And next, pneumonia and emphysema. Consolidation and abscess formation in the lungs seen in the very young and elderly and in the patients with the underlying or recent pulmonary diseases. A severe form of necrotizing pneumonia with septic shock and high mortality is recognized. Osteomyelitis, destruction of bones, particularly the metaphyseal area of long bones. Septic arthritis, painful erythematous joint with collection of purulent material in the joint space. Finally, we will see the laboratory diagnosis of Staphylococcus aureus. First one, microscopic examination. Gram staining. It is a violet color gram-positive cocci arranged in the form of clusters. Motility test, it will be non-motile. Colony morphology on culture medium. Mutant agar, it will show smooth golden yellow colonies. In blood agar, it shows beta hemolysis. In McConkey agar, pink color lactose fermenting colonies was observed. In selective medium, mannitol salt agar, it shows the yellow to golden yellow colonies. Biochemical tests, catalase positive, oxidase, urease, indole or negative. MR negative, VP positive. Citrate elation test positive, starch hydrolysis, casein hydrolysis or negative. It is coagulase test positive bacteria. Telluride reduction test also positive. DNase test also positive. Finally, Staphylococcus aureus infection are treated with oxacillin. Vancomycin for oxacillin resistant strains. Removal of foreign bodies is often required for successful treatment. Finally, thanks to all for listening my video.